UW Health and UnityPoint Health Meritor are requiring patients and visitors to once again wear a mask.
It is effective starting today. All staff, patients, and visitors are required to wear a mask in exam rooms, waiting areas, and scheduling spaces. It's because of high rates right now of COVID, flu, and RSV.
UW Health's Dr. Jeff Pothof is back with his weekly segment. Good to see you.
Hi, Dr.
Good to see you guys. How are you?
Pretty good. So is this a surprise that we're masking up again?
No, it really, when we looked at this, it's a matter of time. So, even this spring, we looked back on respiratory season and thought to ourselves, when all these viruses are going around, even before the pandemic, maybe we should have been masked up to keep people safe, keep our staff safe. And now we've been watching the numbers. And over the last couple of weeks, it's pretty certain that we're in respiratory season now. COVID kind of went up first. Now we're seeing influenza, RSV going up. It's in the community. It's all over the place. So to mask in some of our lower risk areas is one meant to keep our patients safe. I think patients absolutely should expect we do everything to keep them safe, but two, to keep our staff safe, both so they have a happy holiday, but also so they're around to take care of everyone who's coming to UW Health to get care.
Do you think levels are getting high enough that other institutions, stores, schools will follow UW Health's lead?
Maybe. I think healthcare is a little bit different in that the proportion of folks who are vulnerable are probably higher. People come to hospitals and clinics because they're having symptoms, so there's probably greater urgency in those spaces, compared to maybe other public spaces. But not a bad idea to think about potentially masking when we're gathering in somewhat large groups during the height of respiratory season, especially if the people that are going to be there are more at risk, so that we can protect them so they don't get too sick.
And we hear talk of a new strain going around.
Yeah, there's a JN1 strain, which has been around for a while yet, but it's starting to pick up as far as total number of cases. Not seeing a lot of it in Wisconsin yet, but
it's mostly on the northeast.
Northeast of the United States, and then some of the Nordic countries are seeing it. It's got a lot of mutations compared to what we've been seeing recently, but different versions of this strain have been around. They haven't necessarily taken off. They haven't caused more severe disease, so we'd call it a strain of interest right now. Keep an eye on it. We're seeing more cases of it. Is it going to cause more severe disease? Is it going to be a problem? Hard to know for sure right now. I do think it's just one more argument that if you're not up to date or you don't have recent immunity against COVID-19, get it either through a booster or if you had a recent infection, you're probably okay too, but another reason.
The CDC said today that JN1 strain is responsible for about 20% of new infections. And we were just talking about what the difference is between this winter and last winter, and potentially maybe one of the differences that fewer of us are vaccinated this year.
Yeah, or we've had waning immunity. So, last winter wasn't that far away from some of the Omicron surges. So if you chose not to be vaccinated, you had some immunity from your previous infection that you had. We came through this summer with relatively low COVID levels. That means it might have been a year, more than a year, since some people have been exposed to either a vaccine or natural COVID. That puts you at risk of somewhat more severe disease if you happen to run into JN1 or one of these other COVID variants over the holiday.
And the problem with all these respiratory illnesses, they all sort of have the same symptoms.
Yeah. Right.
So you don't know what you have.
No.
Should you test?
I think you should test for COVID because there's therapeutics that we offer to a large proportion of the population that helps prevent severe disease. For things like influenza or RSV, common cold, unless you're having symptoms that are severe enough to land you in the hospital or seek medical care, the treatment is the same. So at that sense, probably not a huge deal to necessarily go and get tested for that. But certainly if you are struggling to breathe or you're getting worse, go to the hospital. We often will test you for those things just because treatment options are different when you get to the more severe levels of those illnesses.
And just the same guidance we've always had about the holidays, right? If you're going to be gathering with friends and family.
Yeah, I think so. You don't want to wash your hands. You want to make sure that you're not coughing on people. And if you're sick, as hard as it is, don't go to Christmas.
Yeah.
Merry Christmas.
Merry Christmas.